But now I'd like to introduce you to Claire Lanigan from the Digital Repository of Ireland, who's going to talk to us about the digital preservation of reproductive health resources, archiving the 8th, or Archiving Reproductive Health for short, which is a project which aims to provide long-term preservation and access to at-risk born digital content generated by grassroots women's reproductive health movements before and during the campaign to repeal the 8th Amendment of the Irish Constitution. This project was funded by Wellcome and administered by the DRI, Digital Repository of Ireland, and is publishing and making available digital collections from activist organisations that otherwise would be lost. So I think it's very clear that the preservation and publication of these collections adds significantly to our understanding of women's rights movements and the history of reproductive healthcare in Ireland. So Claire, I'm going to hand it over to you to tell us a bit more.
Great, thank you very much. I'm just going to share screen now because I have some presentation slides. So that sharing okay, and I'll just put it onto slideshow.
Yep. Perfect.
That's all. Great. Okay, just bear with me one moment. Start. Okay, so Sarah gave a very helpful overview there. So I'll just kind of go over some of the same stuff, but in maybe a little bit more detail. So as noted, I'm digital archivist and coordinator on this project, Archiving Reproductive Health, which is administered by Digital Repository of Ireland and funded by Wellcome. And we were winners in the Digital Preservation Award, Safeguarding the Digital Legacy category this year. So looking at the project to date, we have, as Sarah was saying, we've been working to preserve digital material created by these grassroots organisations, which are working for reproductive justice in Ireland, especially during the 2018 referendum to repeal the 8th Amendment. So to date, we've published a number of collections from key organisations that were involved with the campaign, and a range of oral history interviews with feminist and reproductive rights activists working in Ireland over the last 40 or so years. And then, as I was saying, we won the Digital Preservation Award in the category of Safeguarding the Digital Legacy. So the project is continuing. It continues until the end of 2023. And the collections that it creates are safely deposited in the Digital Repository of Ireland for the long term. So even after the project has officially ended, the collections are protected and preserved in the long term. The Digital Repository of Ireland, most of you are probably familiar with, but I'll just note that it's a national trustworthy digital repository for Ireland's humanities, cultural heritage and social sciences data. It's been certified by the Core Trust Seal since 2018, which is building on our established role as a TDR trusted digital repository. We support best practice in digital archiving, digital preservation, open access, open research and fair data sharing. So a small bit of context. Again, a lot of people are going to be familiar with the 8th Amendment in Ireland, and the campaign, but I'll just do a quick summary. So in 2018, the Irish public voted in a referendum to repeal the 8th Amendment to the Irish Constitution. The 8th Amendment was enacted by another referendum in 1983, and it placed a constitutional block on the right to legal abortion care in Ireland, although women in Ireland continue to travel to Britain and other places to access abortion care before and after that time. When the referendum finally took place on 25th of May 2018, it passed by 66.4%, with every constituency but one returning a majority yes vote. And in January 2019, the Health Regulation of Termination of Pregnancy Act was enacted, making elective abortion care legal in Ireland for the first time in the nation's history. And that picture there is from our collections, and it's from one of the number of marches for choice that were held in Dublin over the kind of 10 years from the period of time from about 2012 up to 2018, and still continues to this day. So we have been working with a number of key stakeholder organizations. So basically, these are organizations that worked on this campaigning over the years that have donated their digital records to us. And that is kind of noted on the left-hand side of the slide here. And then we also have a substantial amount of qualitative data from researchers, primarily oral history interviews, as I noted earlier. So the stakeholder organisations are Abortion Rights Campaign and All Ireland Campaign for Free, Safe and Legal Abortion, Terminations for Medical Reasons, a group that supports women, parents and families following diagnoses of fetal anomaly during pregnancy. The Coalition to Repeal the Eighth, which was a broad umbrella organisation intended to bring together a wide range of civil society organisations that supported the repeal of the Eighth Amendment. Together for Yes, that was a kind of a time-limited campaign in 2018. It was the national campaign for a yes vote, and it was made up of the Abortion Rights Campaign, the Coalition mentioned before, and the National Women's Council of Ireland. In Her Shoes, Women of the Eighth was a Facebook page, still exists, although it's updated, not with stories now, just with administrative posts, which included personal accounts from people who had sought abortion prior to the repeal of the Eighth Amendment, either by going to other countries or by importing abortion pills. There's quite a lot of research data, so I'll just kind of summarize some of it there. Reproductive Justice, Gender and Disability is a disability rights and reproductive justice project based in the National University of Ireland in Galway. It involves interviews with disabled people and their experiences with reproductive health care in Ireland, and that the oral history interviews are preserved in DRI. Physician Advocacy and Reproductive Rights is interviews with current and former committee members of Doctors for Choice, such as an Irish pro-choice physician advocacy group. Posters in City Streets, the Linguistic Landscape of the Eighth Amendment. This is a visual collection created by researcher Louis Strange, which contains hundreds of images of signage, which was across the streets all during the referendum period in 2018. Mixed method research findings from repeal activists. This contains qualitative data collected through questionnaires, which were conducted in 2015, 2020, and 2021, and each provides an insight into activist thinking on campaigning pre and post the 2018 referendum. The pro-choice movement in Ireland from 1983 to 2010. This is a collection of interviews which was carried out by historian Mary Muldowney. The interviews are with pro-choice activists who were involved in the movement at different stages from 1983 to 2010. So they're more oral history interviews. And then Voices of the Irish Women's Movement, which is a similar collection. This was collection comprised of legacy qualitative interviews, excuse me, conducted by Professor Linda Connolly in the course of completing her PhD research in 1997. So there's interviews with key feminist activists and examined their experience of activism, their political approaches, and the methods used by the groups they were involved with. There's also a collection called Retweet the Eight, which contains the tweet IDs of over 2 million tweets related to the referendum. They were collected by a research organization called Quiddity, and they were collected between March 9th and May 30th, 2018 from the Twitter filter stream API. So it's just the tweet ID numbers. So it's not the actual, tweets themselves, but it's kind of like a preservation collection, which just keeps that basic data preserved for the long term. Oh, sorry. So the team we have laid out there. So the top row is our principal investigators. So we have left to right is Aileen O'Carroll, who's our principal investigator in Maynooth University. Catherine Cassidy on the right there is the same in Trinity College Dublin, and in the middle is Natalie Harrower, current director of DRI. So they would have been, they represent the three organizations that make up the DRI consortium. And then the project team is myself, digital archivist and coordinator, Pritam Singhvi, junior software developer, Lorraine Grimes, who was a postdoctoral researcher and also digital archivist, and Murilo Diaz, who's also a junior software developer. So in 2022, this year, we published a lot of collections of design and publicity material from the stakeholder organizations that I was just describing. And we also published some stories from the In Her Shoes Facebook page. So a lot of this material was already familiar to the Irish public and further afield from the referendum campaign, especially the design and publicity materials of Together for Yes. And of course, the In Her Shoes Facebook page was very well known. So these items here, you can see just from the left kind of clockwise, there's a banner from the 2016 March for Choice. So the March for Choice is organized annually by the Abortion Rights Campaign. Takes more the form of a rally in recent years, but in that period around 2016, 2017, it was a very big march. And that design there is echoing the design of a revolutionary newspaper from the period before 1916. So there was a kind of a conscious effort to tie into the decade of centenaries and the 100 years from 1916 to 2016. And then we also have an early logo for terminations for medical reasons, just kind of almost hand-drawn. And then we have a photograph from later March for Choice, which shows an activist group called the Time Travelers for Choice, who would wear like our, old-fashioned clothes and costumes, and we have pro-choice messages on them. And you see there's got design material from the Coalition to Repeal the Eighth, and a sticker from Together for Yes, or infographic from the day of the vote, and then just a picture of banners from the from terminations for medical reasons from the 2017 March for Choice. And just here's a little zoom in on some of the research data. So on the left there, you can see an excerpt from a transcript of an interview with Dr. Marion Dyer. So that's from the Doctors for Choice interview collection. So you can see the text is there. Most of these are text only, but some are audio and text, or audio recording and transcript. And then the image on the other side is from that Posters and City Streets collection. So that is from, I think, Dorset Street in Dublin, and shows a range of posters advocating for a yes or a no vote. So they are from a number, there's ones from different political parties, from the national campaign, and then from the no campaigns as well. Oh, sorry. There's also, yes, there was research data I mentioned there that took the form of oral history interviews from campaigners and women's rights activists from the 70s to the 90s. So you can see just a little summary that the Mary Muldowney interviews were used also in a book she wrote, Sexual Politics in Modern Ireland. Linda Connolly's, of course, was used to inform her PhD and later book. And then the mixed method interviews that I discussed at the start, the survey data, they had been gathered by Camilla Fitzsimon in Maynooth University. So on the 4th anniversary of the referendum, which was 25th of May this year, we published a new set of collections, including publications and reports by the stakeholder organizations. So these reports, these included documents like annual reports, submissions to transnational entities such as the United Nations, submissions to the Irish government, and some internal documents like meeting agendas and strategy packs and similar things. So there's just two examples here. On the left-hand side is the Abortion Rights Campaign Regional Toolkit. This was a booklet developed by ARC in 2017 to help and support the network of regional groups that went on to become the backbone of canvassing teams around the country in 2018. And then on the right, you will see the submission to the Citizens' Assembly by Terminations for Medical Reasons. And the Citizens' Assembly was a precursor to the official referendum campaign. And the submission outlines the ways in which the Eighth Amendment affected people who receive fetal anomaly diagnoses and how many were forced to travel to access abortion care without the support of their doctors at home. So personal testimony from women and couples affected by fetal anomaly diagnoses is a very important part of this document. So again, these submissions were all produced by these various organizations and submitted to government entities, but there wasn't a central location where they were all preserved for the long term until this project. And it's very important that the work that went into these submissions and similar documents is remembered. We're making all our research protocols and other publications publicly available. So these are the ones we've published to date, although we have a whole bunch more coming out next year. So these are our ethics protocol, which ensures the quality and integrity of our research and archiving processes, and a researcher self-care protocol, which focuses on the potential of harm to the researcher when working with sensitive data on reproductive health. I'm just going to do a short showcase. I'm going to show you a video from the Archiving Reproductive Health collections. This is a video from the 2017 March for Choice. I won't show you the whole thing because it's 6 minutes long, but it'll just give you an idea of the scale of the marches for choice in around this period. So the activist who made this video was happy for it to be published on our collections under a Creative Commons license, which is great because it meant that it could be made publicly available and preserved. So I'll just run it for about 30-40 seconds just so you can get, it doesn't have any sound, so don't worry if you don't hear anything. I should note that this is the corner of Merrion Street, Merrion Square and Clare Street in Dublin, if anyone is familiar with Dublin. Goes on like that for another 6 minutes. So it's a nice little showcase. I always like to show that video because it's kind of summarizes a lot of what we were trying to capture, which was just a record of these events that were very significant at the time, but would be quite easily forgotten if there wasn't a visual record of them. I'll just get out of this slide. Oh, sorry, a bit harder. So I just wanted to talk a little bit about the process. So a part of this project was to look into social media archiving, which is actually really quite challenging and not a straightforward process at all. And we were really only looking at the stories, those posts from the Facebook page In Her Shoes that I mentioned earlier. And even that actually provided quite a lot of, or produced quite a lot of challenges. So it's probably important to note these as part of the progress we've been making. Not that it was impossible, just that it was more difficult than envisioned. So this is kind of a brief summary of the process of exporting and analyzing the In Her Shoes stories from Facebook as it was when we started, Meta as it is now. So so when we started the project, there were data parameters established for the developers in terms of the data they were exporting from Facebook. So they were accepting these Facebook posts as text files, so like .txt with relevant metadata. So these parameters were established so that they could download and extract the necessary metadata for the later ingest process. So they got they were able to get admin access to the page. We were working directly with the page, the page creator. So we had to get the developers made basically a full page export in 2018. However, in 2018, Facebook's provision of download for users, even admins of pages, was a bit limited. So the data was partial. The data extraction was partial, and it left a few holes in the timeline. So the initial download was a JSON file provided by Facebook upon request through the settings menu. It provided us with the timestamp as well as the post content. And it was then it looked okay at the time, but when it was revisited afterwards, it was found that the timestamps varied a lot. They weren't consistent, and there were missing posts from the import, and the metadata was also incomplete due to the lack of initial data. So the second export was JSON as well, but it was more complete, which was then processed with a special character cleaning script by Pritam. And then the most important thing that Pritam and Catherine had to do at this stage was to extract the 15-digit ID. So you'll often see on Facebook, a post will have its own unique ID, and it's usually 15 digits at the end of the URL. This was not part of what was available to somebody exporting data from a Facebook page in 2018. So the developers ran a custom script requesting this field. And once we got those post IDs, it could be cross-referenced with a timestamp so that we could establish the correct timestamps, match them to the correct story, and then match them to the correct metadata. So it was all the data, we were getting all the data, but just it wasn't all correlating. So there was quite a lot of work involved with extracting relevant and persistently identifiable data that could be matched. So it wasn't as simple as simply downloading the page data and then off you go. It actually involved quite a lot of revision and fixing, basically. So this issue of missing posts, admin access again was obtained, and this the character cleaning script was used, and then the 15-digit post IDs was used to link back to the stories that we had already collected in the first export. So the timestamps and the post IDs could then finally be correlated and to make sense with each other. Another thing that came up for us when we were working with the In Her Shoes, and this was not so much of a computer science problem and more of a data protection, sociology, ethics issue. So Lorraine worked very hard on this. So the stories on In Her Shoes, the Facebook page, are public and anonymous. We still had an ethical responsibility to consider and respect the privacy of the storytellers, because they had not given explicit consent for these stories to be archived, only just to be published on Facebook. And because they were anonymous, we didn't have any way of finding, and the admin of the page didn't have contact details for them either, because they routinely deleted personal details from the Facebook page from people who submitted in order to protect their privacy, quite understandably. So we had to try and come up with ways of respecting the desire of the storytellers to share these stories, while also carrying out ethical due diligence on their privacy. So we carried out a kind of a light touch anonymization on the stories. Lorraine is still working on this, and it involves redacting or anonymizing details that may be more likely to identify a person. Most of them don't have particularly identifying details, but some have details that would be a little bit more likely to identify somebody, even if the post doesn't have a name attached to it. So it basically involved a lot of manual review of each story and identifying and encoding and mapping out the data. And then we decided on what level of anonymization was appropriate. And we decided that this kind of, not to the extent that they could, we decided that it would be too difficult to try and anonymize them to the extent that even their friends, and because somebody who was close to an individual may recognize details that would not be obvious to somebody else or to a member of the public. But we knew that would involve redacting and anonymizing the stories to such an extent that the impact of the person's story would be compromised. So it didn't seem like it was in keeping with the original intent of the storyteller. So this light touch anonymization was the compromise we came to. Also relevant to data protection was the level of access we provided. So the stories as preserved on DRI are actually restricted to users engaged in research, education, and educational purposes only, which may seem counterintuitive as they are publicly available on Facebook. But again, we have a stronger ethical responsibility than, say, a profit-making platform would have as a publicly funded repository and as a project with very specific ethics protocols. And also it was the way to, on advice from our legal advisor, it actually was the best way to ensure compliance with data protection legislation. So it's not that publishing them openly would necessarily have violated it, because it could be argued that they were in the under the archiving exemption, but it was thought that it would be, if there was any kind of likelihood that the individuals could be identified in a way that was not necessarily beneficial to them, then it would be prudent, as according to data protection law and privacy, to make them available, not necessarily unavailable, but make them available for those who are engaging with them for bona fide purposes like research and education. Now, you will see if you go to DRI that there are some In Her Shoe stories that are publicly available. These are ones that were already published in a 2018 book by Erin Darcy, who's the page administrator. And those ones, the agreement signed with the authors of these stories, they had identified themselves, they had communicated directly with Erin, and they had signed an agreement both publishing the stories and approving their long-term preservation and public availability in DRI. So that was why those ones can be made available. Just wanted to say a little bit about fair data. I'd mentioned it earlier on, and it was an important part, well, of everything, all projects in DRI, but especially this one. So a key aspect of the Archiving Reproductive Health project is the creation and sharing of fair data. And I'm sure most of you are familiar with it, but it's findable, accessible, interoperable, and reusable. The collections that we have published are fair the following ways. So they're findable because they're catalogued using standardized subject terms where possible. They come from terms that come from established vocabularies used in the archiving and library sectors. And then we have been working on a semi-bespoke vocabulary as well, which I'll mention a bit more about in a minute. And they're accessible, they're all open access where possible, with some exceptions as I was just describing, and all collection metadata is open access. Interoperable, like everything in DRI, objects are preserved in open formats. And reusable, we have our deposit agreements with our stakeholder organizations. We have committed to publishing this material under a Creative Commons open license unless otherwise stated. So the vast majority of the organizations have been more than happy to have them published under those terms. We also set up a stakeholder advisory forum. This consists of representatives of each of the organizations whose data we're working with. The aim of the forum is for us to get feedback from stakeholders who are not necessarily archivists or even in this kind of digital preservation world, but who would have, of course, a very close attachment to this material. We want to ensure that we're collecting and archiving this material in the best way possible. So we felt that people involved in the organization whose material we're archiving, either as volunteers or as researchers, were best placed to give us this feedback. We also included experts in the fields of research ethics and digital archiving, and medical ethics. So it's a great combination of different people. And we have had 2 stakeholder advisory forum meetings where we brought various kind of questions to them and have developed policy as a result of that. So for example, the anonymization policy with regard to In Her Shoes was developed in consultation with our stakeholder advisory forum. I noted, obviously, mention again that we won the Digital Preservation Award, and we also won a second prize in the Open Scholarship Prize, which was organised in Galway, GMIT 2022. So it is run as part of Open Scholarship Week, which recognises the substantial contribution that open scholarship makes to the betterment of science and society. So again, emphasising the fair data aspects of this project. So I'm just going to briefly summarise some upcoming work. So we have a number of new publications coming out in the new year. The Guide to Archiving Digital Records for Volunteers and/or Community Groups. It's a guide for volunteer, grassroots and community groups created to assist them with cataloguing, preserving their own digital records. It is focused on primarily digital records, but it also provides information on cataloguing and organising physical records. So there was already a similar guide published by Archiving the Eighth, which was another Wellcome Trust project funded, or Wellcome funded project, which was run by University College Dublin, but this one is a bit more extensive and more detailed. So it intends to provide clear, easy to follow and accessible instructions and advice for small organizations with limited resources, enabling them to make the best use of what resources they have and to preserve a cross-section, at the very least, of their digital records. So it aims to enable small groups to organize their materials in such a way that if they have the opportunity to deposit them in a trusted digital repository such as DRI, they will have well-organized collections and accessible and interoperable formats. So even though it's part of this project, I think it's a document that's going to be very useful to smaller community groups in general as well. We're working on a social media fact sheet fact sheet on social media archiving, which will basically summarize what I described earlier, outline the process of reconciling the 2 exports from Facebook, and then a few of the data protection challenges that come with that as well. We're publishing a finding aid for published collections, which describes the scope and extent of the digital collections and a catalogue of their contents with DOI links. So that's really just a kind of a guide to what we have and where to find it, or how to find it directly. And then we have a vocabulary. So I mentioned vocabularies earlier. So it summarizes the research carried out by myself and Lorraine in developing suitable vocabularies for use in cataloguing these collections on the topics of reproductive health and reproductive justice. So there's been use of existing terms in established vocabularies, and then we have found that sometimes combining different vocabularies in one, and even creating some bespoke ones relating to Ireland, has created quite an interesting combination of standardized terms. So we will be reporting on that process, and then even extending maybe a modified form of existing vocabularies with additional terms relating to Ireland. We'll also be putting this will be more like a list on our website, but it's a registry of. So part of the project is also identifying other data that we don't have the scope to preserve, but that does exist. So at-risk digital data relating to the campaigns to reproductive justice in Ireland, and then making a record of them so that they are noted for any future projects that will have the same scope as this or a similar scope as this. And our big project, or our big event next year, is the Collection Day. So one of the key deliverables is holding a public collection day at which members of the public are invited to bring their memorabilia, ephemera of campaigning to repeal the 8th and of reproductive rights activism in Ireland more generally, to a public event in Dublin where a selection of material can be digitised for later preservation in DRI. So this is going to take place in partnership with Archives Ireland, who are going to carry out the digitisation, and it's going to take place on the 10th of March 2023. We don't have it up on our website yet because we're putting out a call first to invite members of the public to donate material, and then we will select a set amount because we only have the one day to do it, so we need to make sure we can have a manageable number, and then the actual day the invited people will come up and we will do the digitisation on the day. So the Digital Preservation Award has had lots of impact. It's really increased the visibility of the project, both in kind of digital preservation circles and more widely. It really helps communicate our work to a wider audience, so it's been really, really beneficial. And it also shows our funders that the work is having a positive impact. That's both this project funders and also Digital Repository of Ireland, Department of Education funders more broadly. So it has been a very positive, everything about it has been an incredibly positive impact. Even people who aren't familiar with the award are still very impressed by an award. So it's been really, really great. So that's summary of the website, email addresses, and any other contact details. But yeah, all the information I mentioned can be accessed through our website link there, and then that also has the DOIs that can take you straight to the collections. Thank you so much, and keep an eye on our next year's activities.
Yeah, wonderful. Thanks so much, Claire. Can I invite everybody, please, to give Claire 3 cheers or more, if you wish.
Thank you.
Congratulations on your award. I think the judges were just so well. They were struck by, of course, the significance of the collection itself, the importance, the social history aspect, all of that. And I think when we spoke after the awards, you were saying it's particularly pertinent in light of all of what's been happening in the States as well. Yeah, absolutely significant and important collection, which is and a well-deserved award. I wanted to just, before we open the floor, because I'm sure there'll be questions from everybody else, but I just wanted to touch on some of the things that you've highlighted for things that are upcoming in the next year, because I think loads of that touches on lots of things that we're thinking about as well. The bit that you talked about community archives as well, perhaps that wasn't an upcoming thing, but you talked about community archive,
the publication, the guide.
That's it exactly, yeah. Because that was a key theme that came out of the IPRES conference as well, and lots of people are thinking about how to engage better with community archives without sort of stomping in and just, you know, squashing everything that's important to the community. And I wondered how that had come about, whether that was you reaching out or whether that was sort of them reaching in kind of thing.
Well, it was in our project plan when we first submitted to apply for the funding, that like one of the outputs would be the exact form of it wasn't established then, but it was going to be some kind of a guide that could be presented to. Originally it was talking about like groups relating to reproductive justice, but it could be used more broadly. The idea was to provide practical advice to especially very small organizations that didn't have much resources in terms of human or physical or money or anything like that, and wouldn't have had, you know, maybe a huge amount of time. So it was meant to be kind of like, here is how to do a little bit with, you know, little bit of resources that can help a lot. Yeah. And the one that was developed by the sister project, Archiving the 8th in University College Dublin, but from which some of what our one is informed as well, so they're kind of like slightly co-authored, but that was maybe a little bit more focused on physical material. So like if you have you know, all these leaflets, or if you have posters, you know, here's maybe useful ways to store them, and you know, if you can't get them to an archive, at least you can kind of store them in your home in this way. And then it was, you know, a very loose information, a little bit about how to do very basic cataloging. Mm-hmm. So a lot of that took from that and then developed it a bit. So in this document, we have a number of appendices that basically give examples of basic cataloging. So it's like, imagine you have this type of material and these 6 folders, and they contain these categories of material and these types of files, and the digital files we're specifically referring to, but the principles would be the same for physical ones as well. And here is a code naming convention that could be used, that would be useful, and here's how you would go through it and name each thing, and here's how you would organize it hierarchically. So we have a few of those just to give someone, like, it's not a kind of a mandate, it's more like this is a model. If you really don't know where to start, you could start with this model and then see how you need to, if you need to adapt it for your own organization. So yeah, it really was, because we had talked on a kind of a broader top level about, you know, the importance of communities preserving the material, but we did find that a lot of organizations just didn't know where to start and were a bit overwhelmed by the prospect. So we thought we'd kind of go down to nitty gritty, and we have sections about, like, what does copyright law mean, what does data protection law mean, and the very simple breakdowns of, like, you know, if you're worried about whether you can keep this or that, it's there, you can in this case and not so much in that case. And, you know, if you're not sure what license, you know, who's the copyright holder, well, it's going to be the creator, but not necessarily, you know, if you just happen to have it doesn't mean that. So it was also like, here's suggested ways you might reach out to a creator or creators, and decide on a bulk decision. Say, for example, if you have an organization, you can decide as an organization, let's release all our material on this open license, and we'll put this in writing, and it'll be like a thing we've decided as creators. You know, so something like that, just to kind of, you know, again, people don't necessarily have to do it exactly that way, but just, I did find that because there's a knowledge gap, understandably, because, you know, people aren't archivists and they're not professionals. So I thought it would be, I think I can understand the fear of seeming excessively prescriptive, but then I thought sometimes having a little bit of a framework is extremely helpful to people, and it doesn't necessarily mean that it's an instruction. It's just a kind of a, you know, this stuff is it's not as overwhelming difficult as it might seem. And of course, it's not like, obviously, you know, professional archiving is a whole other level, but it means that at least at the very kind of grassroots level, if an organization makes some kind of sense of its material when it gets to an archive, it means that, I mean, the cataloger might have a different approach, but at least they'll know what they're getting and they'll know what's there. They'll be able to identify it, and then they can kind of go from there with whatever way, whatever institution specific. So, like, if an organization catalogs their material and then donates it to a bigger institution like a national library or similar, or digital repository, something like that, the digital repository archivist is getting something that they can at least make some sense of.
Yeah. I think that's great. I think I'd be interested to see sort of levels of uptake, interaction, engagement. That's really interesting. And Jen said as well that she's also equally excited about your forthcoming publications. I'd also spotted and meant to sort of pick up on the social media archiving guidance. In fact, I might contact you about that.
It was less so guidance as more like findings.
Equally so. But anyway, we're chatting, we're just rabbiting on. Paul, his hand up. Paul, have you got a question for Claire?
I have got a question. I don't want to jump in if others do, but I'll maybe kick things off. So yeah, thanks for that, Claire. It was a brilliant presentation. And as Jenna said, it's great to see people diving in and taking on these complex digital preservation challenges and then going straight off to write them up and share their learnings with everyone else. That's fabulous. So thank you for that. Facebook preservation just seems to be a complete minefield, particularly around the sort of consents and permissions area that you touched on. I've just got a very specific question about that. You mentioned the sort of anonymization angle and the significant amount of sort of manual work that went into that. Did you consider using any kind of automated tools to help with that anonymization work? Is that a possibility here, or is it just sort of such a complex problem with the subtleties of getting the amount of anonymization right that it's not really go? It has to come down to sort of hands-on work.
It is possible, and we do, like, so Lorraine was using a tool called MaxQDA it's used by social scientists to encode. So it's basically just establishing repeated terms and flagging them, and and then you kind of attach things by theme. And then also at this current time, Lorraine and Pritam and Marilo are working on they have a kind of a semi-automatic anonymization tool, but it's one that works when you've already established your anonymization protocol, which is just like a big list of what you and not like how, you know, name becomes another name, this is redacted, this is anonymized. And that initial stage of deciding what your anonymization protocol is does actually require the reading. So it's not like every step of it involves going back and looking at all 600 stories again. It's more just that there is a human eye required for the first stage of, because you need to understand the way we could establish that some of the stories could be potentially identified was by reading them and saying, oh, this person mentioned this hospital, which isn't very commonly used, and they mentioned that they're from this small town. Okay, this is good. This is getting a little bit more identifiable, and that's not something we can. Well, it's probably theoretically possible, but I don't know if I would leave it entirely to a script. So what they're working on now is kind of like, they've established what the anonymization parameters and protocol are, and then they're kind of running the stories through that and going back and checking afterwards to make sure it's actually anonymized and redacted correctly. So it does save some of the effort at that stage, and all the way through we've been trying to find ways to automate parts of the process, but also have just been mindful that there is parts of it that you do need to just do the eyes on the page donkey work.
Excellent.
Jasmine Hyde from NLS has also popped a question in the chat box. She thanks you for your talk, says the project looks fantastic. It does.
Thank you.
I'm sure some of this information is in the really interesting protocols you have published, she says, but I was wondering how or if the project addressed the presentation of materials which are maybe quite distressing for researchers or community users or whoever to view and read. Presumably some of the material collected is hard reading. How have you managed that?
Yeah, that's really the entire premise of the researcher self-care protocol. It was an understanding that it was developed around In Her Shoes because those were personal stories. A lot of them were, you know, involved, I mean, as well as, you know, difficulties, traumatic pregnancies. It also involved a lot of accounts of domestic abuse and sexual assault and other sort of obstetric violence and all sorts of distressing things. So not all of them did, but a number did. So Lorraine was working with those, and she and Aileen worked together to develop this self-care protocol. Basically work based on how they worked on her own workload. So it was very much like, okay, how many can you manage per day? You know, is there some days where you can do more and some you can do less? And what kind of activities, what kind of things can you do in between reviewing these stories that can kind of get you out of that sort of headspace? And we looked at a lot of the existing literature about sort of vicarious trauma, which is something that can happen to people in all fields, but it can happen to researchers, especially working in sensitive data. So that was really the outcome of that protocol, was to kind of create a document that other similar projects could use. It basically has recommendations. It's like advice to, you know, a researcher maybe should limit the amount of time they spend on particular types of data, and they should plan their day so that they have a break and some other, you know, non-work activity for a period of time after they've worked with this. And what, again, these can be modified for individual preference, but the essential idea was that care for academics or anybody working with this material is very important and something that we wanted to emphasize. So yeah, that one is published, so it can be accessed through DRI, and we hope it's going to be helpful to other projects.
Super, thanks, Claire. Jen's popped the link in the box as well. So
oh, thank you.